so as to achieve the stated objective. Clear? And it avoids wasteful expenditure and there is economical utilization of various resources. Clear? Now, there are various steps for health planning. There are various steps for health planning. Collection and compilation of health data. What type of data you need? You have to collect the demographic characteristics of that particular community. That means, what is the age composition, what is the sex composition. Next is geographical distribution of the people. Next is, what are the important problems, that means what are the important morbidity among the people who are suffering, and also the important mortality, what are the important mortality. So, you have to collect the morbidity and mortality data. Then you have to think about the trained manpower who will be able to reduce this health problem, how much trained persons are there, whether training facilities are available in your locality or not, how much health centers or hospitals or private hospitals are available in that locality. And last important thing is that the attitude and belief of the people to take the health services. If the people of that community are reluctant to take the services which you are offering to the community for betterment of the health of the children, it will have no use. Many mothers will refuse to get their children injected with the help of DPT vaccine, because it is to some extent painful and it also gives rise to fever for 2 or 3 days. That is why mothers may be reluctant regarding immunization, particularly which are given IM injection. So, you have to motivate the mother, you have to do the homework before implementation of any immunization program. Not only you have to collect the number of beneficiaries, how many beneficiaries there, but side by side you have to remove the misbelief among the mothers or among the parents regarding immunization. So, this program will be successful then and then only if the mothers or if the community people accept your vaccination. Initially, many guardians were reluctant to administer 2 doses of OPV because of false misbelief. Many people thought that with the help of polio vaccination, my children will be sterilized later on. But it is a total misconception. So, you have to remove this misconception, you have to gain the faith of the people. If the people participate spontaneously, ডাক্তারবাবু আমার বাচ্চা পোলিও খাওয়াননি কেন, আমরা 10টা থেকে বসে আছি. So, when they are demanding that my child must be vaccinated, your program will be a great success one. So, you have to search out how many left out children are till not immunized. But when the people demands for this vaccination, then this program will be 100% successful. So, it is the duty of the planners to implement this program by motivating the people, by removing the misbelief, by gaining faith among the community, হ্যাঁ, সুতরাং এই জিনিসগুলো না করলে তোমার প্ল্যানিং সাকসেসফুল হবে না। সো ফার্স্ট স্টেপ ইজ কালেকশন অফ ডাটা অ্যান্ড কম্পাইলেশন অফ ডাটা, অ্যান্ড আফটার দ্যাট ইউ উইল after collection of data, you have compiled the data and you found out that there are health problems. As for example, many underdeveloped children are dying because of measles infection or because of tetanus. So, you gave priority to prevent death of underdeveloped children by giving vaccination. So, there are various problems. Out of these problems, you have to prioritize. Prioritize which health problems you will address first. Why prioritization is done? Because of limited resources. Side by side, you have to resource. Assessment of resources. What resources are there? Whether adequate funds are there, whether trained personnel are there. So, you have to assess what resources we have. Clear? Once you have prioritized that we want to reduce this health problem, then you have to think about the alternate plan, whether there is any alternate plan in terms of cost effectiveness. You can think about 2 or 3 plans, but out of 2 or 3 plans, which plan will be most cost effective? So, you take this cost effective plan. So, you always think about alternate plans which are cost effective. Then you prepare an action plan. You prepare an action plan. Action plan is nothing but detailed planning. Detailed planning. When the equipment or drugs or vaccines will be procured, when the health personnel will be trained, when you will hire the vehicles, when the publicity regarding vaccination in the community will be started, when number of beneficiaries will be calculated. So, these detailed planning will be done with the help of the action plan. And also, you designate the roles and responsibility of your staffs, who will supervise, who will administer the vaccine. Clear? So, this is a detailed planning is there. So, after this detailed action plan, you start execution or implementation. You start execution or you implement the program. Clear? And after that, during execution, you also monitor the program. Monitor means day to day activities. আরে ভ্যাকসিন ওখানে 2 ঘন্টা দেরিতে পৌঁছেছে because of transport problem. So, immediately you sort out the problem, that you immediately take one hired vehicle and immediately send the vaccine. Mothers are waiting there with their children for 2 hours. So, immediate corrective measures are taken so as to improve the efficiency of this program. Clear? So, you started implementation of this program, side by side you also monitor and you take immediate corrective measures to avoid any deficiency. Clear? And lastly, evaluation. Evaluation is at the end of the program, you collect data and you try to compare how much portion of your stated objective have been achieved or whether you have been able to reach your stated objective. আমি অবজেক্টিভে পৌঁছেছি, objective reached or not, yes or no? At the end of your program, you have done evaluation and you are seeing whether you have reached your stated objective. If yes, then you continue this program over the years. Clear? If yes, then you continue this program execution. But if no, then you come here, assess the health problem. You assess the health problem, whether health problems have been addressed properly or not, whether adequate resources were allocated for this program or not. So, you assess the health problems. Clear? So, this is the planning cycle. This is the planning cycle. You may be asked in the exam, what is planning cycle? You just write this diagram. Out of 5, you will get at least 4. No need of giving explanation. Only you write these various steps. One is collection of health related data, analyze and determination of health problems. What are the health problems? There are so many health problems. Out of these various health problems, we have to prioritize. Prioritization of the health problem. And side by side, you have to assess what are the resources we have. What are the resources we have? And then you have to formulate your goals and objectives. A point miss hoye geche. Goals and objectives. You formulate your goals and objectives. Clear? Then you do a blueprint for implementation of this program. So, blueprint for implementation of this program, and after that you try to implement this program, and also side by side parallelly you do monitoring. That means regular supervision of day-to-day activities and doing any corrective measures if needed. And at the end of this program, we collect data and we analyze the data and we compare with our stated objective, whether we have been able to reach the objective or not. If yes, then we continue this program. Clear? That means we will execute this program. But if we are not able to reach our stated objective, if it is no, then we again analyze the data properly and we try to sort out the health problems. What are the actual health needs, and accordingly we have to modify our objective or the goals. Clear? This is the health, this is the planning cycle. You may be posted as medical officer. As a medical officer, you have to do various works, not only for treatment of the patient, but you have to supervise, you have to plan, you have to implement you have to monitor, you have to prepare the reports. হ্যাঁ, সুতরাং এই জিনিসগুলো তোমাদের যে কোনো জায়গায় অ্যাজ এ মেডিকেল অফিসার হিসেবে পোস্টিং থাকলে এই জিনিসগুলো তোমাকে ফেস করতে হবে। হোয়াট ইজ ম্যানেজমেন্ট? তো প্ল্যানিং হলো, ম্যানেজমেন্ট ইজ হাউ গেটিং থিংস ডান। আমি কিভাবে কাজটা করে নেব, হাউ গেটিং থিংস ডান। কিন্তু ম্যানেজমেন্টে যেটা দরকার, কি বললাম, ইউটিলাইজেশন অফ রিসোর্সেস ইন এ কস্ট এফেক্টিভ ওয়ে। কস্ট এফেক্টিভ ওয়ে মানে ইকোনমিক্যাল ইউটিলাইজেশন অফ রিসোর্সেস টু অ্যাচিভ আওয়ার স্টেটেড অবজেক্টিভ। টু অ্যাচিভ আওয়ার স্টেটেড অবজেক্টিভ, আমার যে অবজেক্টিভ আমি ঠিক করেছি সেই অবজেক্টিভে আমি কস্ট এফেক্টিভ ওয়েতে রিচ করতে পারছি কিনা। That is the main purpose of our management. Clear? Management কেন দরকার? Why? কি why management is required? কেন ম্যানেজমেন্ট দরকার কেন? হ্যাঁ, এক কথায় এফিসিয়েন্সি of a program or increase output efficiency of program, or we consider how much output in return of my input which you have invested. আমি এত টাকা ইনভেস্ট করলাম, আমার আউটপুটটা কোথায়? So for any organization, particularly in the private sector, they always think about their output because they are profit making organization. এটা গভর্নমেন্ট সেট আপ নয়, এডুকেশনে কোনো ইনকাম নেই, হসপিটালে কোনো ইনকাম নেই। সো দিস আর দ্য not profit making organization. On the contrary, the government organizations, they are the profit making organization. They will always think about the how much output we have gained by investing so much of input. Clear? সেই জন্য ম্যানেজমেন্ট দরকার। তাহলে ম্যানেজমেন্ট কিভাবে এফিসিয়েন্সি অফ প্রোগ্রাম তুমি বাড়াতে পারো? I will give one example. Medicine, surgery, gynae, pediatrics. Medicine, surgery, gynae, pediatrics. চারটে ওয়ার্ড বয় আছে, ভেরিয়াস ব্লাড স্যাম্পল নিয়ে আসছে ল্যাবে। ক্লিয়ার? কেউ এলো 11টা, কেউ 12টা, কেউ 12:30, কেউ 1টা। এই চারজন ওয়ার্কারের জায়গায় if we fix 1%, that you collect all the blood slides with the help of a trolley and you will move from one department to another department. And after 2 or 3 hours, you will deposit all these samples to the lab. So, we can save the working hours of other 3 group D staffs who can be engaged for doing other hospital works. So, if you plan the manpower in a scientific way so as to reduce the cost, তাহলে আমার 3 জনের টাইম বেঁচে গেল, তাদেরকে অন্য কাজে লাগাতে পারলাম। It is one simple example of improving the efficiency of your hospital work. ওই 3টে স্টাফকে আমি আউটডোর টিকিট করতে বসিয়ে দিলাম, তাহলে আমার আউটডোরে যেখানে টিকিট করতে ভিড় হচ্ছে একটা কাউন্টার ছিল, আমি আরও 2টো কাউন্টার খুলে দিলাম, তোমার ভিড়টা কমে গেল, পেশেন্ট স্যাটিসফাইড হলো, বেশিক্ষণ লাইনে দাঁড়াতে হলো না। ইন দিস ওয়ে ইউ ক্যান ইমপ্রুভ দি এফিসিয়েন্সি অফ ইউর হসপিটাল ওয়ার্ক। ক্লিয়ার? তাহলে ম্যানেজমেন্ট consists of one is behavioral science, আর একটা হচ্ছে কোয়ান্টিটেটিভ। বিহেভিয়ারাল সায়েন্সের মধ্যে আমার অর্গানাইজেশন this organization will be strong enough. That means trained sufficient manpower, good equipments, good reagents must be there. So it is the organization. That means the good organization must be there. Personnel. The trained person will be posted in such a place where we can get maximum output from that trained person. যেখানে trained person দরকার সেখানে যদি একটা untrained person দাও, তোমার আউটপুট ভালো হবে? হবে না তো। তাহলে you give a fit person to a fit position. যে পার্সন যাকে ফিট পজিশনে দেওয়ার দরকার তাকে সেখানে দিতে হবে। তাহলে you deploy your personnel in a suitable position so as to get maximum output from him. Clear? So these are the behavioral sciences. Next is quantitative. What about quantitative? One important is cost benefit analysis and cost effective analysis. আর এটা হচ্ছে নেটওয়ার্ক অ্যানালিসিস। আরও অনেকগুলো আছে, ওগুলো আর আমি তোমাদের বলছি না, কিন্তু মোস্ট ইম্পর্টেন্ট ইজ কস্ট বেনিফিট অ্যানালিসিস অ্যান্ড কস্ট এফেক্টিভ অ্যানালিসিস। হোয়াট ইজ কস্ট বেনিফিট অ্যানালিসিস? Cost benefit analysis is nothing but you are comparing the output in relation to input in terms of money. আমি 2 কোটি টাকা ইনভেস্ট করেছি, আমি আউটপুটে 2 কোটি টাকা আউটপুট হলো না 3 কোটি টাকা আউটপুট হলো। So you always compare your output in monetary terms. That is the cost benefit analysis. আমি যদি সেফ ড্রিঙ্কিং ওয়াটার সাপ্লাই দিই আন্ডার 5 চিলড্রেন, আবার আন্ডার 5 চিলড্রেনদের আমি সবাইকে ফুললি ইমিউনাইজড করলাম, আবার আন্ডারওয়েট চিলড্রেনদের আমি দোজ হু আর সাফারিং তাদেরকে ওআরএস এবং রিঙ্গার ল্যাকটেট বা নর্মাল স্যালিন দিলাম। তাহলে if we give safe drinking water to the children, we will be able to prevent diarrhea among the children to a great extent, rather than treating the suffered children who are suffering from diarrhea with the help of ORS or by establishing various health units in that locality, which is more cost effective. So, this comparison is done in monetary terms. This is the cost benefit analysis. Clear? আমি সেফ ড্রিঙ্কিং ওয়াটার দেবো না আরও হসপিটাল বানাবো, সাপ্লাই ড্রাগস, নর্মাল স্যালাইন, ওআরএস এগুলো সাপ্লাই রাখবো, যে ডায়রিয়া হলে তাদেরকে ট্রিটমেন্ট করবো। আমার সেফ ড্রিঙ্কিং ওয়াটার দিতে গেলে আমার পাবলিক হেলথ ইঞ্জিনিয়ারিংয়ের তাদেরকে অ্যাড্রেস করতে হবে, বড় বড় মেশিন বসাবে, ইকুইপমেন্ট বসাবে, হাউস টু হাউস সেফ ড্রিঙ্কিং ওয়াটার সাপ্লাই দেবে। তাহলে উই হ্যাভ টু কম্পেয়ার হুইচ ইজ মোর কস্ট এফেক্টিভ। ক্লিয়ার? সো হোয়েন ইট ইজ the output is compared with the input in monetary terms, then it is cost benefit analysis. What is cost effective analysis? Cost effective analysis is in the health sector we cannot compare always in monetary terms. We compare in terms of number of lives saved, number of morbidities reduced, how many children are suffering from diarrhea in comparison to previous years. So, you have to compare what you have invested and how many children were saved, how many lives are saved, or how many reduction of the morbidity. So, it is output is compared in terms of life saved or reduction of number of cases. So, it is cost effective analysis. Cost effective analysis is not in monetary terms. Clear? Network analysis. What is network analysis? Network analysis দুটো টার্ম আছে, একটা PERT প্রোগ্রাম ইভ্যালুয়েশন অ্যান্ড রিভিউ টেকনিক, আর একটা হচ্ছে ক্রিটিক্যাল পাথ মেথড CPM, ক্রিটিক্যাল পাথ মেথড আর প্রোগ্রাম ইভ্যালুয়েশন অ্যান্ড রিভিউ টেকনিক। প্রোগ্রাম ইভ্যালুয়েশন অ্যান্ড রিভিউ টেকনিক, এটা জাস্ট একটু ডায়াগ্রাম দু একটা লিখলে তুমি বুঝতে পারবে হোয়াট ইজ নেটওয়ার্ক অ্যানালিসিস। You have started a project work. You want to give immunization to under 5 children and your objective is 100% immunization. So, you started this project work. For that, you need the trained person. So, you have recruited the staffs, trained persons, and after recruiting these staffs, you have to give training, proper training of those persons. So, you train them within 2 or 3 months, side by side, you have plotted tender and various companies came to a chamber and ultimately you fix one company and they will deploy the valuable equipment. They will deploy various valuable equipment and this deployment of equipment will take a long time. It may take 10 months. In the meantime, your staffs have been recruited and they have been trained properly and at the time of installation or before installation, all your staffs have been trained properly and this trained person will start working with the help of newer equipments or newer devices and ultimately they will start work and they will give the result. Result or output. This is the end of the project. So, one is admit, starting point, one is end point. So, you are graphically showing the various activities at various stages. If there is delay in any stage, suppose if the installation of equipment takes more than 10 months, your trained person will sit idle and ultimately they may need reorientation training. আরে বাবা তোমাদেরকে পড়িয়েছি আমি, এক বছর পরে তুমি তো ভুলে যাবে, তাহলে you need reorientation training. So, if there is delay at any stage, whole program will be delayed. So, this is the graphical representation of various events or various activities and you take corrective measures at various stages so as to complete the program within a stipulated time period. It is the network analysis. The longest path of this network analysis is the critical path. তাহলে এই পাথটা বেশি সময় লাগছে, এখানে 10 মাস, এখানে 2 মাস, 12 মাস. So, it is the longest path. Clear? So, it is the CPM, critical path method. হ্যাঁ, মার্ক্সবাদী কমিউনিস্ট পার্টি নয়, critical path method. ঠিক আছে? The longest path of the network analysis is the CPM.